Hello, everybody. Thank you so much for joining us for our webinar today on anxiety disorders and treatment. Your presenters today are Jarrod Gardner and Justin Heath. Before I introduce both of them, I just want to go over a few key reminders. The talk will run up until 2:45, 2:50. So we'll have a question and answer session about 5 to 10 minutes at the end of the hour. So if you have any questions or comments you'd like to share, please feel free to drop that in the chat box throughout the webinar. Please remember to mute your sound throughout the whole presentation. And if you aren't comfortable, you can turn on your video. As I mentioned, your presenters today are Jarrod Gardner and Justin Heath. Jarrod is a third-year graduate student in the EDS Educational Psychology program at the University of Utah. His current placement is at Kearns Junior High, assisting with behavioral, emotional, and mental health support in a special education classroom. Justin is a third-year graduate student in the EDS Educational Psychology program at the University of Utah as well. He previously worked as a special ed teacher prior to entering grad school. Justin currently works at a behavioral unit in Granite School District, and his position has a variety of roles and responsibilities, including teacher consultation, leading social skills groups, counseling, and behavioral management and support. Welcome, Jarrod and Justin. We're excited to have you here today. I'm going to go ahead and turn the time over to you.
Great, thanks, Annie. Happy to be here. I mean, that might be a little bit of a lie sometimes, you know, when you have to present and you're feeling the same thing that you're presenting on. So that's always a fun thing. But thank you guys all for joining us today. I will go ahead and pull this up as a presentation. Okay, so as mentioned previously, we are going to be talking about anxiety disorders and treatments. And you know, as graduate students and any student in any school, you know, we start to feel anxiety, especially when we have to be able to like complete our deadlines, put in our notes, do our homework, take finals, things like that. And that's when we start to really feel those emotions and everything that crops up on us. So we wanted to go over like specific types of anxiety disorders and be able to talk about those and what we might see within ourselves or within others that we work with, whether it be students. So that way you can kind of help and guide that. So just a little fun picture here that you guys can kind of enjoy when your anxiety goes away, and having no anxiety gives you anxiety. Yeah, so just a fun picture to help get going here. So the first thing that we really wanted to talk about is we have the differences between anxiety and fear. So as school psychologists, Justin and I are working towards that. We use the DSM a lot. The DSM-5 TR just came out about 8 months ago with some revisions, but we use that to really look through and to diagnose people and classify them. So the first thing is we have fear, is the emotional response to a real or perceived imminent threat. So that's one of the biggest differences, is there's an actual threat there, and we have to be able to respond and react to that threat that's going on at the time. So for example, we might be, you know, I hope that this doesn't happen to people, but you know, you might be in the wilderness and a bear might try to attack you. That's an actual threat, and your body responds to that in a correct manner. Whereas anxiety is a little bit different in that it's an anticipation of a future threat, or something that might not be physically there at the moment, but you're still feeling that emotion. So that was the main function of fear and anxiety, is to act and signal of danger or a threat, and to trigger our adaptive responses in our bodies. And then when it does trigger, we have our 5 senses that we use, our seeing, our hearing, tasting, smelling, all those things. And it helps us to analyze and to be able to react to the immediate threat in our environment. One thing you can kind of think about fear-wise is like if you had someone honk a horn at you, that's an actual threat that's being there right then and there. And then you feel that response in your body where you might get tensed up, you might get a little bit angry and stuff. But then it just kind of releases at the time, whereas anxiety can be prolonged. And we're going to talk about that as we get further into the presentation. So just a little bit of biology here, going back into maybe undergrad or even before that. So you have the sympathetic versus parasympathetic nervous system, or the flight, fight, or freeze response, versus the rest and digest response. And so you have these to be able to react to those things. And again, hopefully you guys aren't getting chased by dinosaurs. That'd be pretty impressive if you guys were. But some symptoms that you might see are your heart rate increases if something's coming after you or there's a threat. You have pupils dilate, your muscles contract, and stomach stops its digestion functions. Whereas when you're just sitting there, you're relaxed, maybe you're reading a book, maybe you're watching a TV show, you have these different responses where your saliva increases, your heart rate drops, your muscles are relaxed and everything. So these are kind of things to kind of set up for what we're going to be talking about, because when anxiety happens, you're having more of that sympathetic response where you're flight, fight, or freezing. So to kind of set the basis for what we're talking about, what is anxiety? Again, anxiety, you guys have probably learned before, is a part of everyday life, and it can be beneficial when you're in stressful responses. One of the things to think about is when you're taking a test. When you have that anxiety, you're more motivated maybe to study, to be able to think better. And so that can actually help you push yourself. Maybe you're performing or doing a sport and stuff. So you can really see that anxiety can be beneficial in those moments. However, you have parts where you might have minimal anxiety and can interfere with that performance. You might have that moderate anxiety where it improves that performance. And then you might have that elevation of where you reach that high anxiety and it can be detrimental to your performance. So you have to be able to monitor those levels and see where you're kind of at. And when it does become it becomes intense, it can be frequent and it can make you worry, you feel a lot more stress in your life, and it can interfere with those daily activities and your everyday life that you're going through. And that's when it starts to become a problem, is when it starts to interfere with those daily activities. And anxiety is one of those things that, you have symptoms that can begin in childhood and go throughout your adolescent years and persist throughout in adulthood. And you have to be able to figure out ways to manage those anxiety feelings that you may have. So our next thing is to push into what anxiety disorder actually is. So we all have anxiety, but again, it doesn't become a disorder or a medical problem until it really does impede your way of life. So you have intense, excessive, and persistent worry and fear about everyday situations. You're constantly feeling like you have a heart rate higher, rapid breathing, sweating, and feeling tired. Those are just some physical symptoms that you may be feeling as you go throughout it. Often anxiety disorders have repeated episodes. So you may not have it one time, but you're going to have it multiple times, whether it be throughout the week or the month or the year. And again, it interferes with those daily activities. Maybe you don't go outside because you don't want to have a panic attack, or maybe you don't want to go into situations because you have social anxiety. So those things can really impact you and make it so you can't have those social interactions, or the even just occupational or things will impede you. And then again, you have intentional avoidance for that. So one statistic that we have is about 25 to 35% of the US population meets the criteria for anxiety disorders in their lifetime. And so that's quite high. If you think about it, that's a quarter of the population in the US, and that's not even just including around the world, because there are different ethnicities that will have that crop up differently. Some biological factors to take into account too about anxiety disorder is that it's highly hereditary. Man, I can't even talk right now. Sorry. And then you have some psychological factors that may come into play as well, where you have stressors in life that, maybe you're low SES, and there's just a lot of stressors that, you can't provide, you can't eat food, you don't have the resources, you don't have food, water, anything like that. That can be a stressor and cause anxiety disorder to really come up. And then you also have the fact being that you might be in a family where they've taught you to fear neutral situations, and that can really impact you as well. Again, you have like these physical symptoms that you may be feeling, but you also have these psychological ones where you have like racing thoughts and overthinking situations. So that's kind of the key steps, or the key to anxiety disorder right there. So kind of going further into about the DSM, anxiety is more associated with muscle tension and vigilance in preparation for future danger. And again, it's excessive. And then the other key factors is it differs on the different anxiety disorders, which we'll be talking about, but it typically lasts more than 6 months, but again, has flexibility. So you have to be able to know your information about the DSM. And if you're becoming a clinician, therapist, things like that, you have to know these, like how long it actually takes to be able to be considered a condition for them. And again, it develops in childhood, and if it is not treated, it can become worse. And then the other thing that you keep in mind is a lot of these disorders is like 2 times more frequent in females than it is males. And, some possible explanations, these aren't scientifically proven or anything. But the fact being that first, women, tend to report symptoms more. Men are encouraged to face their fears, their anxieties, face their emotions head on. And then childhood sexual abuse is another possibility, biological stresses, social expectations, and brain chemistry. A lot of those things will come into play for that. And then also cultural factors, like I mentioned before, will come into that and cause that to elevate compared to males. And then also all these are listed as not being caused by medications, drugs, things like that. So we'll talk about that as we get going more. So these are just an outline of what we'll be talking about, but we'll talk about separation anxiety disorder, selective mutism, social anxiety disorder, panic disorder, agoraphobia, general anxiety disorder, and just phobias in general. So the first one that we have is separation anxiety disorder. And these are all listed developmentally in the DSM, and that's kind of how we're going. So these are like younger age when they begin. So separation anxiety disorder is when you have excessive fear or anxiety concerning separation from a home or attachment figures. You're always constantly worrying about them, whether you be at school or something like that. You have someone that might be in the classroom and they're just worrying, looking out the window, worrying about their mom or dad. They might be, slipping in the shower or dying. They might be worrying about events themselves. And the other thing is on separation anxiety disorder is it exceeds developmental level. So we have younger kids who are obviously going to be attached to their parents, but as they get older, they should be able to go into those environments and not have to worry about their parents, not have to worry about anything like that, and be able to function correctly. But when separation anxiety disorder happens, that's not possible for them. They also, worry about maybe getting kidnapped or having an accident. And then also other things that might happen is they have repeated nightmares involving separation. They may have those somatic symptoms crop up for them, like headaches, stomach aches, nausea, vomiting, and it might last at least 4 weeks for them, or it has to last at least 4 weeks for them in children and 6 months in adults, or more, to be able to classify and diagnose them with separation anxiety disorder. The next one is selective mutism. And this interferes with educational and occupational achievement for people. They don't initiate responses or reciprocate with others who are non-immediate family members. They will sometimes will talk with family members, but not outside the home. That has to be inside the home. And it not only contributes to, or at least 1 month, it has to be lasting for at least 1 month with them. But the thing to keep in mind is younger kids, especially when they get into schools, is they will be nervous. They don't know anyone. They don't have friends and stuff like that. So it does mention in the DSM not to count the first month of school when that happens. And it also has to be ruled out that it's not contributed to a lack of knowledge or comfort levels or communication disorders, or of course, autism. That's definitely something that co-occurs when you have selective mutism. So they have to be able to rule that out as well, or co-diagnose with it as autism. It usually before 5 years old happens. And again, it results in social impairment as children, They become anxious about it, and they sometimes, or a lot of the times, will have to use augmentative and alternative communication, or AAC, to be able to communicate, whether that be PET systems, the iPad, cough drop, things like that, to do that. So the other slide I have, the next one is panic disorder. And so that's recurrent attacks, and it can be unexpected or it can be expected attacks, where you may have gone through the situation before and you know it's going to happen and it can be expected and you're going to go through it. And that panic disorder makes it so you're avoiding those situations that cause that attack. You know, you might be in a stressful moment, you might be like public speaking and you had a panic attack and you just avoid that like the plague. And panic disorders usually don't last very long during the time that it starts and the end. It usually reaches its peak within about 10 minutes and then kind of comes back down. Some things to look out for in panic disorder is it's unexpected. There may not be an obvious trigger or cue, and it just happens. Heart racing, you might have lightheadedness, breathlessness, hyperventilation, stomach distress, and at least one attack followed by one, and it requires at least one attack by 1 month of excessive worry on that. And it has, again, like all the other ones, not attributed to substance abuse, other mental disorders. It could be one per day or one per week, so it just depends on that one. And the median age for it is about 20 to 24 years old in the United States. And another statistic that the DSM mentioned, which was kind of interesting, but it makes sense on that, is that African-American adults have been reported to have more chronic course of this. And so it could be possibly due to enduring impact of racism, discrimination, the stigma to receiving mental health services. And so just keep that in mind, that there's, again, a lot of variability depending on what race it is. So.
Perfect.
And I will turn the time over to Justin on this part.
Awesome. Thanks, Jarrod. So yeah, so just kind of going over this, I think it's really important that we kind of really talk about and distinguish between the different types of anxiety, because as all of us, you know, and involved in the mental health field, we may encounter like other teachers, parents, or just any other individuals who might say like, oh, like, I think so-and-so may have like anxiety. But that can mean a lot of different things. And as we're talking about this, there's anxiety can take a lot of different forms, and there's a lot of different diagnoses involved in this. And so I think it's really helpful to kind of go through the DSM or other similar types of things and really distinguish between the types of anxieties and really find out the symptoms of each of these disorders, so that we can be more successful in providing consultation and treatment. And so the first one I wanted to discuss is agoraphobia. And so essentially agoraphobia is anxiety about two or more of the following situations. So you have to exhibit symptoms in at least two of these symptoms. So using public transportation, you know, buses, trains, the tracks, things like that, you may experience anxiety. Being in open spaces, such as like a parking lot, being in enclosed spaces, such as a movie theater or a store where it's a little bit more enclosed, surrounded by other people, being in a line or being in a crowd with others, and then being outside of the home, being inside of your house alone is another as well. So you have to have at least two of those, 5 to have diagnostic symptoms of agoraphobia. And so essentially the individual will try as much as they can to avoid these types of situations that will provoke this anxiety. And so another diagnostic characteristic is that these situations that are mentioned, they almost always produce anxiety whenever the individual experiences them. And it has to be out of proportion to the actual danger posed by the situation or context. And then some statistics on it, approximately 1 to 1.7% of the population in the United States, individuals meet symptoms that meet the diagnostic criteria for agoraphobia. Perfect. Next slide. Awesome. And so the next one is social anxiety disorder. So this may be one that most people are a little bit more familiar with. It's more of a commonly discussed anxiety disorder. So social anxiety disorder is really marked fear or anxiety about one or more social situations where the individual is exposed to possible or supposed scrutiny of others. So some examples of this are like having a conversation, meeting unfamiliar people, being observed eating or drinking, or performing in front of others, like giving a speech or a PowerPoint presentation on Zoom. And so essentially another thing is that individuals, they really fear that their actions will be negatively evaluated or judged by others. They might think about things such as being humiliated or embarrassed by others, or being rejected by others as a result of that negative evaluation. And so in order to meet diagnostic criteria, a social situation almost always has to provoke fear or anxiety for the individual. And these individuals tend to avoid or endure social situations with intense fear. I think that's really striking, that they really do have to really kind of like when you think of enduring something, they're really like it's a lot of work and a lot of stress for an individual when they're involved in social situations. And it has to significantly impede their social or occupational functioning, or with adolescents or children, it has to really, affect them socially at school, or that's providing them a lot of anxiety. Okay. So the next one is going to be generalized anxiety disorder. So this is the most common anxiety disorder. And so essentially it is excessive and persistent worry occurring more days than not for at least 6 months. Individuals with generalized anxiety disorder, they really just have a great deal of difficulty controlling their worries and anxieties. And so they have to meet 3 or more of the following symptoms: restlessness, easily fatigued, difficulty concentrating, having irritability, having muscle tension, and then sleep disturbance, having your sleep significantly disturbed as a result of your worries and anxieties. And so it has to significantly impact psychosocial functioning. It's something that's very pervasive. And as I mentioned before, it has to be diagnostically, it has to be persistent for at least 6 months. And so individuals with generalized anxiety disorder are constantly thinking about these negative outcomes. And so they may be intensely thinking about and avoiding different situations that they deem may be negative. And so they're just working as hard as you can to avoid these negative outcomes. And so in terms of statistics, it is 0.9% among adolescents and 2.9% among adults in the United States. Okay. So our next anxiety disorder is a specific phobia. And so individuals with specific phobias are fearful or anxious or avoidant about certain objects or different situations. So I'll go over some examples. So the most common one that people may be aware of is animals, such as like spiders, insects, snakes. That's a big one for me, and dogs. And then things in the natural environment. You can have a phobia of different things in the natural environment, such as heights, storms, or water. More medically related things, such as like having needle injections or other invasive medical procedures. Then there also can be situational anxieties as well, such as being on an airplane, going on an elevator, or being in an enclosed an enclosed space as well. And so essentially these objects or situations that you have this specific phobia over, it almost always has to provoke that immediate fear or anxiety. And individuals Say, for example, someone is fearful of spiders, or if they're fearful of heights, they will do kind of like everything that they can to avoid those types of situations. And then if they are involved in them, they really endure them with intense fear or anxiety. Okay. All right. So that kind of concludes the different types of anxiety disorders we wanted to go over today. So I just thought it was really important to, these are things that I've had, before my grad school classes, going over the different anxiety disorders and discussing them, but it was really helpful for me to prepare this presentation. And I hope it was really helpful for everyone listening as well, to just get a reminder of what those things are, because I think it really can be helpful for us as mental health workers to be as up to date and familiar as possible with the different symptoms and diagnostic criteria of different anxiety disorders and how they differ from one another. And so anxiety as well, there can be a lot of danger and risk involved to this, to those that have anxiety. Those with anxiety can have suicidal thoughts. They may have suicidal attempts and even death by suicide. So panic disorder, generalized anxiety disorder, and specific phobias have been identified as the anxiety disorders most strongly associated with suicidal thoughts and suicide attempts. And this is really interesting, as well as the comorbidity of it, is that 60% of those with anxiety disorders, they've had one or more additional disorder. So most commonly it's paired with another anxiety disorder or depressive disorders. So factors that increase the risk of anxiety disorders. So like most other mental health disorders, so for example, one area that I've studied a lot is autism. Is we know with autism that genetics play a massive role in determining, if an individual will have autism spectrum disorder. And it's the same thing with anxiety, is that genetics, it has a 30 to 50% heritability rate within families. And so I think that's really important to know as mental health workers. Whenever we're doing something like an intake or developmental history, it's really important that we get family history in regards to mental health disorders, because that can really help kind of inform us, because we do know that genetics and family history plays such a big role in determining, who has certain mental health disorders, and anxiety is no different. So other factors are medical causes, such as stress due to an illness, having like heart problems or medical procedures or other health problems that can increase one's risk of developing anxiety disorders. Other mental health disorders, I mentioned before that depressive disorders are another one that tend to be comorbid with anxiety disorders. And then trauma or traumatic events can greatly increase the risk of anxiety disorders. And then stress buildup from different things in individuals' lives can play a role as well in increasing your risk. So here's some anxiety disorder statistics. So 31.9% of teens have an anxiety disorder. And then only 36.9% of people struggling with anxiety will get treatment. And so what's really interesting to me is, we're coming off of a global pandemic where everyone's lives were greatly affected by the COVID-19 virus. And so I think that, this may be anecdotal, but I really think we're seeing a rise in anxiety disorders and those experiencing different types of anxiety. And so I think it's really critical right now that we're really aware of the fact that, our adolescents and other adults that are in our lives, that, something like a pandemic can really increase the risks of having an anxiety disorder. And so, I think especially with anxiety disorders just being so common in the general population, as Jarrod said, that 25% of individuals in the United States have an anxiety disorder, that can help us really be aware and look for signs and symptoms of those that we work with for possibly having anxiety disorder, so we can provide treatment, because I think it's really critical that we help support and provide treatment to others, because, as of right now, around 37% of individuals aren't receiving that treatment that can greatly affect and improve their symptoms. So here are some different treatments for anxiety disorder. This is a fairly common one, cognitive behavioral therapy, or CBT. So essentially, cognitive behavioral therapy is systematic exposure to feared situations that is self-guided. So you're really kind of thinking through and critically examining in your own mind different situations or things that make you anxious. So, if it's social anxiety disorder, you're really thinking, you're kind of like examining those situations and learning to recognize your own thinking in regards to like social situations. So according to APA, cognitive behavioral therapy involves learning to recognize one's distortions in thinking. You want to gain a better understanding of the behavior and motivation of others. I'm just really trying to understand the motivation of others and why they might be acting a certain way towards you. That can be something that can be really helpful. And then learning to use problem-solving skills to cope with difficult situations, and then learning to develop more confidence in one's own ability. These are kind of the different types of approaches that therapists or other mental health workers that use CBT, they really try to help individuals with. Our next one is acceptance and commitment therapy, or ACT. So, or ACT. And so acceptance is the first step in this process, to where you fully embrace all of your thoughts or emotions, instead of fearing, avoiding, denying them, or judging them. So it really involves you like taking thought of like, oh, like trying not to be like so hard on yourself, or like fearing or avoiding things, where you're really more embracing them and just recognizing them for what they are. And then number 2 is cognitive diffusion, observing your thoughts. So kind of like acceptance. So you're accepting your thoughts. Okay, this is how I'm feeling. But then you're also going to think about your response to those thoughts typically, and what you typically do. So that can really help you understand your reactions more, and if your reactions are appropriate or not to your thoughts and feelings. Number 3 is being present. So really attempting to focus on living in the moment and focusing on things that are present, because as we know, anxiety disorders are really about fearing futuristic events. And so really attempting to live more in the moment and being present and focusing on your present thoughts and emotions. Number 4 is self as context. So realizing that people are much more than their thoughts, feelings, and experiences. And just trying to understand the role of and other people's perspectives more, and how they might be reacting. And so just kind of seeking to understand others more. Number 5 is value, identifying what your personal values are. This is a common therapy approach and technique for other areas, but really identifying what values are important to you and how that can impact your life. And then number 6, most importantly, is committed action, taking concrete steps that align with core values to produce change. So kind of you've gone through all 5 of these steps, you've accepted your thoughts, you kind of label your responses to those thoughts, you try to be more present, try to understand others more, identify your personal values, and then now what you're going to do is take action steps to try to produce change in your life. And so that's just kind of a quick rundown of what ACT therapy is, and how it can be effective. Perfect. Another treatment that is very common is medications. So there's 4 common types of medications. There's SSRIs, which are responsible for increasing serotonin in the brain. SNRIs are very similar to that. They also increase serotonin, but differently. They also increase norepinephrine front. I'll be honest, I'm not exactly sure how to pronounce that, but it's also responsible for increasing that chemical as well. And then more of a short-term medication are benzos, which are more sedative in nature. You can look on the right at the graphic to see what those types of medications are. They can be like Valium or Xanax, but these tend to be more short-term things because SSRIs and SNRIs, they take around 4 to 6 weeks to really take effect and actually produce those chemical changes in your brain. And then the last one are, these were more of the older anti-anxiety meds that were first developed, the MAOIs. They have more severe side effects, so they're less commonly used now. But as I said, these were kind of the first anti-anxiety drugs that were developed. But they're kind of used now when anxiety or depressive disorders are very severe or unusual in nature. But as I said, these aren't commonly used anymore due to the more severe side effects. And then other treatments for anxiety that are therapeutic or medically related are support groups. So, identifying support groups in one's community, it can be really helpful just to be around others that have, similar symptoms to help support each other. And just a simple Google search can kind of help. If someone is struggling with anxiety disorder, they can, search on Google different groups or supports that they can attend to help them with their anxiety disorders. And then lastly is stress management techniques. These have been really found to be effective as well in treating anxiety disorders. Mindfulness exercises, meditation, exercise, different things like that can reduce stress, can go a long way to treating anxiety disorders.
So just to kind of conclude, so this is the end of our presentation. And so we don't expect you guys to be experts in anxiety disorder. This is a lot of information, kind of like a fire hose of information for you guys. And again, we're not trained in being able to diagnose these things. You have to be a clinician who has been trained in it and has the proper training and education for it. But these are things that you can kind of watch out for. And if you need to make recommendations and talk about it with other people, and then also, these things might, I'm not saying that people are diagnosed with these things, but these things can help you whether you're diagnosed with anxiety disorder or whether you just battle with some anxiety every once in a while. The thing to remember is, there are definitely a lot of treatments out there that you can use. And then again, mindfulness and meditation, those things are great because you can look those up online. You can do them within 5 to 10 minutes and be able to, help calm yourself down when you do become overly stressed and anxious about things. So just making sure that we have that information. And again, this is not an exhaustive list. There's still other things in the DSM. And if you don't use the DSM, there's ICD-10 as well that has things in it. So there's a lot of resources out there to make sure and to go over with that. But again, just making sure that at this time of the year, you're taking care of yourself and you're watching out for those that you work with, because like Justin mentioned before, we've gone through a pandemic, COVID-19, and we are seeing an increase of a lot of mental illnesses. And so just making sure that you're supporting those and have those resources available to those that you do work with. All right, so for anyone who has questions or comments about our presentation, feel free to ask now.
I have a question. I love that. That was so succinct, so helpful. What are some helpful ways of determining which specific therapies would be most helpful for a specific individual? How do you see this myriad of helpful ways of coping and then choosing the one that will be the best for a specific individual?
Yeah, that's a great question. This is not again, disclaimer, not an expert in this, but just from my understanding, I think using as many of these approaches as possible is most effective in treating anxiety disorders. So for example, therapy and the different, therapy approaches, CBT, ACT therapy, those can be great resources. Someone might respond better to CBT, or they might respond better to ACT or other there's other therapeutic approaches as well, for treating anxiety. So that if you just did that, that would help someone. If you combined it with medication, you see even more improved results. And then if you also implement stress management techniques, or if someone attended a support group, just the more things that you can do to treat it, the better outcomes you'll have. So what I would say is, if someone really does have an anxiety disorder, they meet criteria for anxiety disorder, or they're even close to that, they're just having a lot of anxiety, I would say using as many of these approaches as possible is beneficial, because a lot of it is going to be trial and error. Certain medications may not work for someone, so doctors or psychiatrists can adjust medications as needed, and same with like therapists. If their client isn't responding as well to like CBT therapy, they can adjust and give different therapy models. So I think it really depends on the person of what's going to be most effective for them in terms of stress management, medication wise, or therapy. But I think the most important thing is that it's most effective in treating symptoms when you're getting as many of these things as possible. Does that answer your question?
Yes, it does. Thank you. That was very helpful.
Yeah, and just to piggyback a little bit off of Justin too, I think it's important in our career fields to be aware of these things, to research them. And that way you can be like, oh, I think this one would, match this person a little bit better because I know them, I know their history, I know how they react to different things. So being aware of the background and the techniques of each of those therapies would definitely be useful in being able to choose which one you would have done. And again, it's a trial and error thing. So if it doesn't work, maybe let's try a different one. And it's kind of like throwing the kitchen sink at them at times, but finding that one thing that does work for them, and then you just hit that key and you're like, okay, great, let's keep working on that.
Yeah, I think I'm agree with both of you guys. Something beautiful about therapy is that you can start with one technique, and you can shift to the other. Like you can start with CBT for that person that you think, oh, CBT might work in this moment. And then when you realize that it's not working, you can immediately switch to mindfulness exercises or something like that. That is something that I learned when I was working on my internship, that sometimes in the moment you're gonna kind of figure it out and find ways to help that client that is in crisis.
Awesome. No, that was a great answer, Pamela. Thank you. Does anyone else have any further questions?
Wonderful. Thank you, everybody, for your questions and comments. We'll go ahead and conclude today's webinar. One big virtual round of applause for our presenters today, Jarrod and Justin. Thank you. This presentation is recorded and will be published to the UTTEC Lab website and YouTube channel, which you can access by going to u-tteclab.com. Again, thank you everybody so much for attending, and I hope you all have a great day.
Awesome. Thank you, everyone. Appreciate it.